I'm doing a late night video. It's 3 in the morning. Can't sleep. I guess it's not so much that I can't sleep, it's that having issues with the bladder as usual. I've been in contact with my original surgeon that was supposed to have surgery in December. We have rescheduled everything for a day after my birthday. So I guess that's a present. I don't know if it's a good thing or a bad thing, but like my friend said, I guess it'll be good in the long run because I don't have to worry about it. I guess my dad is getting, I wouldn't say comfortable with the idea of me having it because he doesn't really want me to have it, but I know as a parent, you know, you always worry about your kids. You don't want them to be sick or anything. I sound congested. I've had a cold and haven't really wanted to treat it with normal medications. And usually do a lot of herbal teas, holistic as they say, but yeah, sometimes things work, others things don't work. The 16th of February, I have to do the COVID test again. I meet with my surgeon, my anesthesiologist, my stoma nurse, and I know because Dad is also my part-time caretaker, the people or the company he works for is going to teach him about the things he's going to have to do for me. You know, we've been preparing. Tomorrow I think we're going to watch a lot of things I should have on hand for after surgery, like food, things like that. I bought like washcloths because I know they say that, at least the videos I've seen, that after surgery you shouldn't get any of that wet. So I got I think there's 12 packs, maybe 11, but hopefully that works out. I know they told me I would be in the hospital for about a week. I'm hoping just a week, just because I don't want my animals to go crazy, because I'm afraid that my dad may or may not keep up with the care. He sometimes has days where, sadly, he loses and he forgets. But if he is I know they say if I'm negative for COVID, which I've been twice, he can become my designated person who can come and stay with me for a couple hours, give or take. I've been looking on at mostly pharmacies for the Hibiclens. I'm probably butchering that name right now. Who's got it cheaper? Actually, let's see this. Yeah, this one at Walmart, it's a little more pricey, but they have it at another pharmacy a little bit cheaper. So I was thinking of buying that because I know from what I remember, they sent me the same paperwork that I already made photos of, what meds to stop certain days before surgery. A lot of them I don't even take, but the pain pills and most of the stuff I'm gonna have to stop taking within a couple days. I know day before surgery I can't eat anything, so it'd be more of a liquid diet, which I'm okay with because I have to keep my kidneys functioning too. I don't need that to be an issue. Although, I mean, being a diabetic, that causes issues already. But they're functioning well, which is a good thing. I've seen the surgery done 4 or 5 times now, thanks to YouTube. Gonna go back to, looking for things to prepare myself, I guess, mentally. Because I know it's a big thing. It's a big thing, but I'm just tired of having to run to the bathroom, having to constantly injure it using catheters, the pain that it causes. I'm done. They've told me even when I went and got the second opinion, because I already have pain in my bladder, even if they tried doing the part where you cath, that the pain would still be there. It's enough having MS and dealing with pain, and now having to deal with that. No, thank you. Just take it, get rid of it now. That's one less thing I have to worry about and we'll have to do later. Hopefully, well, I know things are gonna go okay. But, it's one of the things I'm stressed about it because I'm thinking about it, and sometimes when you do more research, it kind of gives you anxiety. Depression's not working, and not in the sense not working, it's just that I get those days where I just feel numb and I have to watch something to make me cry. Probably because I've been dealing with a lot of things that most people won't understand, or at least my family wouldn't understand. I do know that with my new insurance, they do cover like telehealth. So I was thinking of maybe looking for a counselor that way. They still kept me on the same dosage of the Lexapro, or the generic for Lexapro. I'm hoping that at least that keeps working. I also messaged my endocrinologist and asked if it would be okay if I went back on the pills to help control the sugars, although she said that she would, but still wants me to do the insulin. So I'm not sure if she's talking about the nighttime one, because I've always done that nighttime one. Not perfectly, but enough. I have to go in my closet, the big closet, take out that stuff and start packing, because the stuff I had that I was taking with me. I got new slippers, so obviously these are coming with me to the hospital too. I may leave my tablet here at home. I will take these headphones with me and a charger for that, my phone, and I know that there is one article I did read that I should bring all my pill bottles with me. I mean, the doctors know everything that I take, but probably be easier. Plus, if the nurses need to help me with the medications after surgery, because I probably will be loopy. I just hope that pain-wise, that they give me something I'm not allergic to. It sucks when you're allergic to stuff. I was just telling my dad today, because I became allergic again to shellfish, things like that. I loved eating it and can't anymore. It's like, I guess it's a good thing, but on the other side, you kind of miss eating things you could, and now your health is all screwed up and your immune system is all shot. And then, of course, we're talking about the COVID vaccine everywhere. So it's one of those things that, I'm up for getting it, but there's not enough yet. I know they said for most patients maybe by April. Maybe. We'll see how that goes. My dad got his shot because he's a caretaker, so I think about a week before my surgery, he has to go get the second shot. He said everything was okay. He didn't feel any side effects besides the hurt in the muscle, but it's the same as getting the flu shot, which they got late. My cats, I haven't really let back in here. They tend to come in every so often, but I know after surgery, I won't be able to do a lot of the things that I could, like lifting 40-pound bags of litter or 25 pounds of food. Right? No, I think those are 15. I switched it out because I prefer them having more natural things. I like it. It's just good. The dog prefers the Blue Buffalo than the other food that I had for him, so I may or may not need to buy him another bag before I have to do things one at a time because it's like going to overwhelm me and don't need that. And it's enough trying to control diabetes and control the emotions and everything else that comes with it, and just wanting family to be more supportive, because I know I have a lot of friends that understand. Like my friend had to have is it the J pouch, and she said if I ever needed help with changing the stoma that she would be willing to come and help me. And it's something that even with my dad, he's like, oh well, I'll probably call someone and have the vents cleaned out and yada yada. Like, why don't you do this now before I have surgery? But yeah, he's my dad. That's usually how he is. I'm not gonna change him. Can't, because he can't force somebody to change. My mom is sick. I'm hoping that she hasn't caught COVID, because I know with her being asthmatic, that would be pretty bad. And one of my good time friends is back in the hospital. She had a heart attack, I think last month. She didn't want me to know about it. And I was trying to call her, and I got in contact with another friend of ours, and she's back in the hospital, and nobody knows her condition. I'm hoping she's okay, but yeah, too many things at once. Sorry. But that's my update for now. At least things are pushing forward for the surgery. I know my sister's pretty bummed out because usually they're helping her with the kids. I was there today helping babysit my niece and nephew, and did the dishes, gave the baby a bath, things like that. Which kind of caused some pain, but I just chalk it up because I'm always in pain. I think that's one thing all of us MS patients can agree on, that there's always pain. Even I've noticed, like I tell my dad I have to start getting out because I don't know, I just don't feel right. staying at home all the time. I did speak with my friend that we would always do like Japanese get-togethers and watch anime and play video games together. I told her that I was going to dress up as a character from Your Lie in April. I didn't tell her which one. But then I was looking because I know how after surgery things will be a little different. So I also have to ask my friend who had the J pouch, skirt-wise, is it high cut, low cut, things like that, so I can get my costume together. I also have to get the material because I want to do the uniform that they have. And I did find where I can get like the skirt and everything, but like I said, because of surgery, I wanted to ask my friend about that. So I will do that tomorrow, probably tomorrow afternoon. And then we're getting together as a group on the 30th on Zoom, which would be awesome. Excuse me. I always love seeing my friends. I usually, a couple times a week, we always log into Zoom and we hang out a little bit, which is fun. And I've been playing a lot of Minecraft on my tablet. But I realized that with one of the worlds that they gave us, I may need to buy a remote. Oh. Yeah, I'm sorry. It's pretty hard. Yeah. Your mind can't really focus on one thing and it's just a jumbled mess. Sometimes miss the things I used to be able to do, but just gotta get used to this being my new norm. Which is, I guess, okay, because I know things aren't gonna go back, especially with the MS and everything that's already screwed up. So I just gotta do things little by little and start planning things out. Even though it was today, the 17th. About a month and 2 days, month and a day. But I'm always like that in anything. Be prepared. Because I'd rather be prepared than not know what I'm going to expect. Well, I'm going to leave it here because I'm going to start crying.